While Washington's focus really zeroed in on those two hearings today, the president prepared a revised health care pitch. President Trump is on his way to hold a rally next hour in Kentucky to sell the Obamacare repeal and replace plan. Chief White House correspondent John Roberts is covering the hard sell from the White House. Good evening, John.
Brett, good evening to you. Much of what happened up on Capitol Hill today was out of President Trump's control. So here at 1600 Pennsylvania today, he focused on something he could actually wrap his arms around, the new health care bill.
In an effort to get a health care bill that can pass the House, President Trump met today with the House Speaker Paul Ryan, HHS Secretary Tom Price, and one of the most outspoken critics of getting rid of Obamacare, Dr. Ezekiel Emanuel.
That's a disaster. By 2026, 1 in 5 Americans are not going to have insurance. That is worse than before the Affordable Care Act was created. That is not a place we want to be. It's basically Australia with no insurance.
Emanuel was one of the architects of Obamacare, but the president, who has been listening to many different voices as he struggles to cut a deal, saw value in listening to him.
I think that despite our political and policy differences, he wants to hear ideas not just of him, but a lot of people. So it is hearing his ideas, it's listening to his suggestions, and figuring out if we can make it better.
Speaker Ryan hopes to get the health care bill to the full House by Thursday, and there are indications what gets voted on will look far different than what the Congressional Budget Office scored just a week ago.
That is among the things we're looking at doing, yes. And the point I would say is we're going to let people buy what they want to buy. We're going to have more plans being offered, more choice and competition. And this is before Tom Price does anything to deregulate the marketplace, to bring more competition and lower prices, which the CBO could not and did not analyze.
Ryan is putting together a so-called manager's amendment, an amalgam of changes to the American Health Care Act. Among them, provisions that states could impose a work requirement for able-bodied Medicaid recipients, allow states to accept a fixed block grant for Medicaid, and boost tax credits for lower income and older people.
As we continue to meet with folks, there's some staff-level discussions that occurred over the weekend. There'll be more later this afternoon. And to the extent that we can make changes that I think enable us to maintain 218 votes, we will do it.
The president continues to push back against calls from some Republicans to repeal Obamacare first, then take time to put together a replacement. HHS Secretary Tom Price says that's a non-starter.
What that does is place vulnerable people at risk, and that's not something that the president's willing to do. It's not something that he said he would do. Certainly what he has said is that repeal and replace need to occur essentially at the same time, concurrently.
And the president again taking his campaign to sell Obamacare repeal and replace on the road tonight, speaking before people at a campaign-style rally at a 15,000-seat arena in Louisville, Kentucky. Brett?
John Roberts live on the North Lawn. John, thank you.